Namaskar and hello. Let us talk about the prognosis, that is the scope of treatment for sleeplessness, or it is also called insomnia. My name is Dr. Rajesh Shah. I am a director of Life Force, where we treat patients of all kinds of physical, emotional disorders, chronic and recurring diseases from all parts of the world. Sleeplessness is just one of the many. Well, since sleeplessness or insomnia is a very common disease, at Life Force we have treated and documented over 1,000 cases of sleeplessness of various types. Well, sleeplessness is a common problem. Practically every person would suffer with sleeplessness sometime or the other, just for a couple of nights or maybe a little longer. However, that wouldn't call for a treatment. We are concerned about the treatment of sleeplessness only if it is very severe and it is for a prolonged period. So when one doesn't get sleep for 2 to 6 weeks and longer, or there are episodes of sleeplessness periodically and one may not get sleep for more than 2 or 3 hours, or the sleep quality is extremely poor, then that may require a treatment. Sleeplessness is apparently a very simple condition, but it is a very complex condition because still we have not been able to understand the exact cause of sleeplessness. Sleeplessness can be multifactorial in the sense that one may have sleeplessness due to physical factors, stress factors, chemical changes in the body, drug-induced use of or abuse of medicines, hormonal reasons, immunological reasons, food, environmental factors, and so on. So one has to really identify the exact causes, or the couple of causes that may have triggered this sleeplessness, and treat accordingly. One thing is very important to understand, that for treating sleeplessness, just giving a medicine which can induce sleep, what is also called as sleeping pills, is not a solution for sleeplessness. If you want to get your sleeplessness treated at a root level, then one has to treat the cause and not induce the sleep with some chemicals for 1 or 2 nights and then get addicted to the sleeping pills. That is not a smart way to treat sleeplessness. One is to figure out the causes. You see, these days, the overuse of screen, the mobiles, social media, the lifestyle, keeping the mind active with too many activities, too many events, watching television till late and disrupting the natural sleep pattern. All these factors are responsible for sleeplessness. So one has to also regularize one's lifestyle. One has to bring some discipline in the food habits, work culture, and so on. This all will work together. Another very important aspect to get relief in the sleeplessness is to practice some form of meditation. Sedentary life or not having exercise in one's life also is very important cause of sleeplessness. So one should also add some physical fitness programs, some exercises, some yoga, some walks, and so on. Use of right kind of music also helps alleviate sleep. Is homeopathy recommended for sleeplessness? Yes, homeopathy is very strongly recommended for sleeplessness of all kinds, because homeopathy offers to get better sleep. It tries to induce more of natural sleep without using the chemicals. Homeopathic medicines will not produce dependency. It will not have adverse effects. Homeopathy is very strongly recommended for practically all the cases of sleeplessness. Homeopathic medicines, they do not use sleeping pills. So as a result, it is not that you take the medicine and immediately in a couple of hours time you will fall asleep. No, homeopathy will essentially try to regularize your internal cycles, your internal system, and also will treat the cause, especially psychological factors, stress factors, etc. And thereby it will bring about inducing natural sleep in you. The duration of treatment for sleeplessness, well, if it is of short duration, one has been experiencing sleeplessness for just a few days or a few weeks, then one may need a treatment for maybe 6 to 8 weeks. That should be sufficient. In the cases which have long lasting sleeplessness for years, and those who are on strong medications to induce sleep, the treatment may be required for 1 year or even longer. So I hope this video will help the patients seeking help for sleeplessness, and also it will help the doctors and the medical students. Thank you very much.